Hello and welcome to Back to the Science. I'm Dr. Susan Oliver and I'm a scientist, and this is Cindy Oliver. She's hiding. Have a look, Cindy. And she's a dog. And with me today is Dr. Jonathan Howard, and he's a psychiatrist and neurologist. And with him is Nellie Howard, and she's a cat.
Very old cat.
Oh, okay. How old is Nellie?
Almost 19.
Oh, wow, that's amazing. Cindy's only one, but you know the little pretty cat, Cindy? Anyway, you're probably wondering, because normally I don't have guests on my show, and that's because I am really crap at interviewing. But it was worth it in this case because Jonathan has just written a book called We Want Them Infected, which is available on Amazon. And it's such an amazing book. I thought it was worthwhile me bumbling through trying to be an interviewer just so you can all find out more about the book. Now, I was going to say in a nutshell, the book is really about contrarian doctors who put fame above lives. But I'd just like to ask you, Jonathan, what inspired you to write the book and how did you come up with the name?
So I have always had a long fascination with the anti-vaccine movement. And it began probably about 12 years ago when a doctor that I trained with, the only doctor in the book who I met, a woman by the name of Dr. Kelly Brogan, morphed into one of our country's most famous anti-vaccine doctors. She is even further than any of the doctors I discuss in the book. She denies germ theory is real. She denies that SARS-CoV-2 causes COVID. She denies that HIV causes AIDS. But through her, I learned all about the anti-vaccine movement, and I learned how to refute their arguments with the help of some people who came before me, like David Gorski, for example. And it was astonishing during the pandemic to see the same arguments that she had made about measles and the HPV vaccine be recycled during the pandemic. For example, just one example amongst many, she wrote an article, I think in 2014, essentially saying that the best way to protect yourself against HPV infection was to get HPV infection. And that makes no sense. It's kind of like poking out your eyes so that you don't need glasses. It works, but kind of defeats the purpose. But that thinking became mainstream during the pandemic.
Okay, and the title, We Want Them Infected?
The title, We Want Them Infected. So in some ways, that's kind of the most important part of the book. And it's really the best part of the book. And it's really, in some ways, all that you need to know. The title is to be taken literally. That quote comes from a man by the name of Dr. Paul Alexander, who wasn't just some random crank. He was he worked in the Trump administration as an epidemiologist. And he said that on July 4th, 2020, before everyone was vaccinated. And it really shows the Brogan-esque idea of trying to purposefully infect young people, children, young adults, even younger middle-aged people with a virus, with the idea that the best way to get rid of a virus is to spread it widely. So we want them infected. Those were his words, not mine. And it became policy spread by many important, influential doctors who, as we will discuss, were largely sheltered from the consequences of their words.
And just picking up on that, the fact that a lot of the doctors who were making these claims didn't actually see any COVID patients themselves or experience the horrors of the pandemic. You unfortunately did, and you devoted a whole chapter in your book to this, which is chapter 2, everyone, if you want to buy the book. Would you like just to, I guess, sort of tell us exactly what it was like working during the pandemic?
Yeah, so I think here in New York City, we got hit first, at least in the United States, and we got hit the hardest. 3 years ago at this time, anyone who worked in a hospital was surrounded by COVID, and nothing but COVID. I saw more patients die in April and May 2020 than I had my entire career. And I saw, dozens of others as sick as could be, but survived. Some of them had been intubated for many months. I saw some young people die. The youngest person I saw die was 23, and that really left an impression on me because it showed that, occasionally the virus could, kill young, healthy people. Looking back on the whole thing, I actually don't think we had it the hardest in New York City. I think every doctor and nurse and healthcare worker in almost all parts of the world experienced some of these scenes at some point. After the summer of 2020, New York City, we were actually never hit very hard again. And we all of our patients were unlucky. Elsewhere, they were misinformed, and we were treated as heroes here. I don't know if we really deserved it, but people sent us cards, people sent us food, they clapped for us, which was nice. And elsewhere, doctors and nurses were attacked by angry, paranoid, misinformed patients, and I never experienced that. So I don't think that I had it harder here in New York City. But what my experience taught me, I hope, is to gain a little bit of humility for what this virus was capable of. When it was allowed to spread out of control, it overwhelmed us, and there were giant trucks behind my hospital to store the dead bodies. Every 5 minutes, the code blue, someone needing to be intubated, team pager went off. When usually it goes off, maybe once per day. I don't know. It was just an entirely different time. Pediatricians were treating children, excuse me, that's normal. Pediatricians were treating adults, and gynecologists were treating men. So it was just a very horrible time, and no one who worked here will ever forget it.
So in your hospital, Bellevue Hospital, that's normally just sort of neurological and psychiatric conditions that are treated there. Is that correct? I only know that I hear it on like when I watch Law and Order and things. They sometimes take patients to Bellevue Hospital, but I know that's a TV show. But yeah.
Yeah, no. So Bellevue is the oldest public hospital, I think, in the entire country here in the United States, and it has a reputation as being a psychiatric hospital, which it definitely is. That's probably about a third of it, but it's a full-fledged hospital with capable of strokes and trauma and heart surgery, everything. I will say this: that most of our patients during COVID came from hospitals in other neighborhoods in New York City. Our emergency room was never really that overwhelmed. But when you look at read some of the accounts of doctors who worked in Queens and Brooklyn, assuming you know those places,
I've been to them, yes.
Oh, great. But they described it like a war zone, and just the accounts of, people dying in hallways. At Bellevue, it was chaos, but controlled chaos. We never quite got that overwhelmed, fortunately.
Now, something that seems to be doing the rounds on social media at the moment is that the patients that died just died because they were put on ventilators. Would you like to just quickly dispel that myth based on your own experience?
Well, it's not just based on my own experience, except to say, I know I personally never intubated anyone. That really wasn't my role. But doctors who did it because their patients were crashing, because they were breathing 40 times a minute, which is a sign of decompensation. Their oxygenation levels were falling. These were very, very, very sick patients. But my experience doesn't refute the idea that ventilators killed patients. There are two things that do. First of all, kind of common sense, meaning, let's say all we had to do to save the lives of our patients was nothing, was not to intubate them. You think we would have figured that out. Yet it was after that, it was in the winter of 2021 that America had its worst wave, when we had 2,000 to 3,000 people dying every day. So do we think that those patients all died from intubations? That's number one. Number two, I guess there's more than two reasons. A lot of people died at home. Deaths at home surged during the pandemic. And yes, maybe those were some people who were having run-of-the-mill heart attacks and were too scared to go to the hospital. I'm sure that happened. But I'm sure a lot of those patients had COVID. Number three, this has been studied, and there was a meta-analysis of 12 studies which was published, which found that there was no impact on intubation, on mortality. And at least one study, you can link to this in the show notes if you want, I'll send them to you. One study found that early intubation was associated with improved survival. But even if it was found that intubating patients was dangerous in COVID in ways that it wasn't for previous diseases, the idea that we would have been expected to know that the moment the virus hit our shore. Again, you had pediatricians treating adults, gynecologists treating men. You had people like myself making decisions about whether I should amputate some old man's leg, a neurologist and a psychiatrist making those decisions about parts of the body I never, really think about. It's just sort of insane. But this idea, which I do discuss in the book, was I don't know if it was started by doctors necessarily, but it was amplified by prestigious names. And then it went from Stanford University to QAnon memes on Twitter. It was really astonishing to see. And I think that some of these doctors did this because they vastly underestimated COVID at the pandemic start. And rather than say, I was wrong, they started spreading myths that people were dying with COVID, not of COVID, that death certificates couldn't be trusted, that it was lockdowns that killed people, as if asking people to sit on their couch for 2 weeks would lead to mass death. And then finally, that it was frontline, overwhelmed doctors who murdered their patients. And no allegation that I make in my book, I think, is as strong and as horrible as that one. I don't accuse anyone of directly killing people.
Yeah. And I think another important point that you make is that all the frontline doctors like you were putting their lives on the line. And sadly, you did lose some colleagues and they're no longer around to talk.
Yeah, no, those doctors have been truly silenced, unlike any of the doctors that I discuss in my book.
Okay, so another sort of, I think, really important theme in your book is the fact that a lot of the arguments that we're hearing now from the contrarian doctors are the same old anti-vaxxer arguments that we've been hearing for years. Would you like to sort of tell us a little bit more about that?
Yeah, that's largely the last third of the book. So I became sort of a mini expert in the anti-vaccine movement, thanks to my old friend, Kelly Brogan. And it was fascinating and sort of tragic to witness the ideas that she and other anti-vaccine doctors and people said about measles or HPV prior to the pandemic be repurposed for COVID. So it was very common before the pandemic for anti-vaxxers to minimize measles toll by saying, in the pre-vaccine era, only 1 out of 10,000 children who contracted measles would die of it. More children died of car crashes. Measles was, a benign childhood illness for nearly all children, et cetera. Only 400 children died per year of measles. And that's all true. I suppose the vast majority of children with measles did just fine. But if the vaccine can save the lives of 400 American children per year and prevent, 50,000 hospitalizations, that's not bad, right? And I heard the same, the same. COVID was described in the same way, that COVID only kills 1 in so many thousand children who get it, and it only kills 400 children per year, and more children die of suicides. Except it wasn't quacks and germ theory deniers like Kelly Brogan. It was top-notch, prestigious, respected doctors from Harvard, Stanford, UCSF, Johns Hopkins University, all making this claim. And of course, the biggest thing is the idea that the vaccine is more dangerous than the virus. So someone like Kelly Brogan would bring up some rare 1 in a million potential vaccine side effect and treat that as a fate worse than death from measles. And a lot of doctors did the same here. They treated, I know you've discussed this quite a bit on your videos, which I love and have learned so much from. Thank you. Discussing vaccine myocarditis as a fate worse than death. And I mean that very literally. There were doctors who wrote articles called, no, young adults should not live in fear of COVID, where they wrote, young people have many reasons to avoid the virus, maybe not wanting to spread it on to someone else, but fear of death isn't one of them. Those same doctors would turn around and talk about vaccine myocarditis, which, however you feel about it, is not as bad as death. We can agree on that, I hope. And they would treat this like it's a catastrophe, like, oh my gosh, And I don't want to be seen as minimizing the vaccine side effect. But again, it's not as bad as death. And more children died of COVID than were affected by vaccine myocarditis.
Yeah. And I think one of the other points that a lot of people that you mentioned brought up is they bring up all the other causes of death and say, well, children die from car accidents. We don't seem to care about that. They die from drownings. We don't seem to care about that. Even children die from gunshot wounds. We don't care about that. I'd just like to say in Australia, we do care about that, and we actually have gun laws to stop things like that happening, just sort of mention. But let's start to talk about the fact that a lot of people are saying, well, there's other causes of death, so therefore COVID doesn't matter.
Yeah, so that is called the fallacy of relative privation, the idea that because A is worse than B, we shouldn't care about B. And it's kind of silly. The fact that more children die of car accidents is, in my opinion, not a good reason to let some children die of COVID. A point that I state in the book is that I think 0 children should suffer or die for lack of a vaccine from COVID, from polio, from HPV, from any vaccine preventable disease. If there was a vaccine against car crashes and I could give my children the car crash vaccine or the COVID vaccine, I would give them the car crash vaccine. But until someone invents that vaccine, I'm going to protect them with the COVID vaccine. And all of this, of course, was just used to minimize COVID's impact on young people. It's not as bad as XYZ.
And I think it ignores the fact that we have been doing things to like reduce deaths in car accidents. I remember when I was a kid, we used to travel in the back of cars without seatbelts. I mean, there weren't seatbelts there to put on. And that's, I don't know what it's like in America, but that's illegal now in Australia. You must be properly restrained in a car. All new cars now have airbags. They didn't have airbags. We're continually doing things to decrease deaths from any cause. So I don't know why people think that COVID should be special and we should ignore it. Something I mentioned to you previously is I used to do research looking at potential treatments for a condition known as neuroblastoma, which is a childhood cancer. It actually only affects about 12 per million children. But no one has ever said to me, oh, your research is useless, you shouldn't bother, there's not enough children. Most people understand that every child deserves a life and deserves to live, and anything we can do to prevent a child death, we should do, except for COVID.
And guns here in the United States.
Oh, yes, of course.
Although I will say 80 to 90% of us agree it's the 10 to 20%, the tyranny of the minority. But that's a different conversation.
It's a different conversation, and one like from anyone outside of America, we just do not understand it at all. But
oh, don't worry. Most of us who live here don't understand in America
don't either. Yeah, okay.
And let me just make one other point about this fallacy of relative privation. You know, when people say things like more children died of suicide than of COVID, that's true. But one reason is because we didn't let 73 million American children get COVID at the pandemic start, as some doctors suggested we should have done. So the fact that we did a decent job of protecting children at the pandemic start was used as evidence that they didn't need any protection from it, not even a simple vaccine. So I kind of liken this. There's a line in The Simpsons where Homer yells at Marge, you made me get all those smoke detectors and we haven't had a single fire yet. So it's kind of that logic. And I'm not calling for school closures and masks on toddlers. I'm just, I try to keep it very simple in the book, just the simplest 2, maybe 3 shots. And there was so much controversy about that. It was astonishing.
Yeah. And I think one of the things that the contrarian doctors seem to have been doing is reinventing maths almost. It's like we're hearing, well, only 1 in a million children would die of COVID. Now, you've done the numbers and it's very different, isn't it?
Yeah, no, it's not hard math. So this was one of many just obviously bogus statistics that appears in the book that doctors said. So there was this paper that during the first 6 or 7 months of the pandemic, maybe a little bit longer, COVID killed about 1 in a million American children between the ages of 5 and 11. That's different than saying that COVID would only kill 1 in a million American children. Now, as I said, there are about 73 million American children. And so if COVID only killed 1 in a million of them, well, that's not hard math, about 73 would die. In fact, we surpassed that probably after the pandemic's first 3 or 4 months, for example. Children, by the way, have a very unequal rate of dying. Infants have by far the highest risk, and then elementary school children have the lowest risk. So far, over 2,000 American children have died, which if 1 in a million died, that would imply there are 2 billion American children, which obviously there are not. Yet doctors repeated this myth that 1 out of only a million American children died well after, 200, 300, 400 children had died. It would require 300 or 400 million American children, which is more than the population of our entire country, which is 330 million. So they just put these bogus, false, obviously wrong statistics out into the public's mind. So these weren't doctors just chatting with each other. These were doctors on largely heard podcasts and interviews with large social media followings, and all of their errors, all of them minimize COVID. So I'm not talking about disagreements in policy in this book as much as I am talking about just getting basic facts right.
And you sort of mentioned about doctors with huge social media accounts. One who just happens to be on YouTube like me is Dr. Vinay Prasad, who, strangely enough, pretty much blocked me as soon as I started my Twitter account, even though I had never mentioned him or...
Wait, he blocked you? I'm astonished.
Yeah, I blocked on Twitter. And I have, to be honest, about a year ago, I did actually do a video that featured him, but he blocked me like a year before that. And I'd never had any interaction with him, never mentioned him. I don't even know how he knows I exist. But anyway, I'm blocked. But he has... been putting out a lot of information that is just, I guess, plain wrong. And something that you mentioned in the book, which I think is particularly important, is drawing graphs in a way to make something seem less important or less of a risk than what it is. Would you like to talk a bit about that?
Sure. Let me just talk a little bit about Dr. Prasad, who's someone I admired before the pandemic. He wrote this book called Ending Medical Reversal, which maybe I'd feel differently if I read it now, but per my memory, was a really exceptional book. And he, I think, has led the charge against the pediatric COVID vaccine. And he started voicing his opposition in January of 2021, before any child had been vaccinated, before even the results of the vaccine trial were announced. He began campaigning against the pediatric COVID vaccine. And one of his arguments at the time was that COVID rates were falling and therefore children probably wouldn't need the vaccine. And then a couple of years later, today, he argues that they don't need the vaccine because they all have natural immunity. So whether COVID cases were going down or whether COVID cases were going up, he used that to bolster his argument. Yeah, in one chapter of the book traces how anti-vaxxers have a history of using dishonest or manipulated graphs to make it seem like vaccines don't really work. And he did that. He analyzed a trial out of Singapore, and he just had a graph with sort of 2 columns, and you couldn't see any difference between them, unvaccinated and vaccinated. It made it look as if there was no difference. But other smart people, whose names I'm going to be totally butcher, so I'm probably not going to even try. Kyle Sheldrake, I think, is one. And then there's a emergency room doctor from Yale, who's, I'm going to butcher her name, so I'm just not going to embarrass myself. But she did this wonderful essay called a case study in graphs that crushed my soul, which really just showed he didn't even label his y-axis, and depicting vaccine data for a 2 to 3 month period via bar graphs. It was just a way to manipulate and to make the benefit of vaccines seem much smaller than it actually is.
Okay, we could go on, but my little thing here tells me we're running out of time unless we upgrade to Pro. So I'd just like to say thank you, Jonathan, for joining us. I actually had tears in my eyes when I was reading chapter 2, just listening to your experiences during the pandemic. I'd recommend to everyone listening that you purchase Jonathan's book. I'll be putting a link in the video's description to where you can buy it on Amazon, and also probably I think you can also get it from the publisher. Is that right?
Yeah, either
Yes.
it's Red Hawk Publishing or Amazon, either one.
Yes. So we'll provide links to both of them in the video's description. We'll also provide links to a few of the other things that we discussed in this video. So for everyone who's still listening, thank you very much for listening. I have a spiel that I do now and I can't remember what I say. Please remember this video is about the science, but you shouldn't take it as medical advice. For that, you should speak to your medical practitioner. And even though Dr. Howard is a medical practitioner, you should still always speak to your own medical practitioner because they know you. And thank you to everyone who has liked or commented or shared this video because it helps the algorithm and means that more people will see the video, which is really important because this video is about a very important topic.